Now to IT-Mate, a new study reports a staggering increase in alcohol-related deaths during year one of the pandemic.
Wish TV's medical reporter Dr. Mary Gillis spoke with one addiction specialist who shares what you need to know before you or a loved one become part of that statistic. Hi, Mary.
Hi, guys. Okay, so social isolation and quarantine caused millions of Americans to turn to alcohol to cope with pandemic-induced anxiety, depression, and stress. According to a study published in the Journal of the American Medical Association, average alcohol-related deaths increased annually just over 2% between 1999 and 2017. But in 2019, 78,927 people died from alcohol-related injuries. That number jumped to almost 100,000 in 2020. This translates into an almost 25% increase in Americans who lost their lives to the disease compared to previous years. I spoke with Lindsay Bland, addiction program manager at Eskenazi Health, who tells me the first thing a patient can expect when they come to Eskenazi looking for help.
First thing we want people to know is that treatment is available and recovery is 100% possible. And that when somebody shows up at our door and they walk in for that initial intake assessment, we are going to celebrate that with them. We want to reduce the stigma in our community as much as possible around this and help people understand that, people are just trying to get by.
Bland says she has seen an increase in clients coming to Eskenazi during the pandemic with alcohol use disorders. There's also been a rise in emergency room visits due to alcohol poisoning and patients coming in for detox. According to the Mayo Clinic, alcohol use disorder can be mild, moderate, or severe. Signs and symptoms that you may be an alcoholic include being unable to limit the amount you drink, unsuccessful attempts at cutting down, and not being able to fulfill obligations at work, school, or at home. Reporting from the studio, I'm Wish TV's medical reporter, Dr. Mary Gillis.